What's up, everybody? Dr. Rossi, shrinksandSneakers.com. I've been on a kick of talking about how lifestyle modification, things like diet, exercise, sleep, and stress reduction actually lead to improved mental health. And I've been meaning to, for the past several weeks, get to making a video about antidepressant diet, right? What is the best diet, or what is the group of habits, dietary habits, that helps somebody to deal with depression, to potentially improve their depression significantly without taking any type of medication. So for this video, what we're going to do is we're going to cover the so-called antidepressant diet, and I'm going to present some of the data that Dr. Felice Jacka, who's in Australia, created, and how she used this diet to help treat mental health disorders, specifically depression. So I want to just give you guys a little bit of background first on this diet and why it works, or what is the evidence we have to support dietary interventions for treatment of depression. So there's over a decade of observational data. Now understand there's a difference between observational data and randomized controlled trial data. Observational data is usually not as good, but most dietary interventions and most diet-based studies are observational in nature. So there's observational data linking people's diet to the risk for depression. So there's a link between diet and depression. And these findings are consistent across countries, across cultures, and across age groups. So these are consistent findings no matter where you go in the world, essentially. A healthy diet is actually associated with a 30% reduction in the risk for depression and a 40% improvement in cognition. So an improvement in the way someone is thinking and their ability to think. So significant reductions in depression and cognition and enhanced cognition. After this, you also see these results when you control for things like educational level, income, other healthy behaviors the person might be engaged in, and things like body weight. So when you control for those things, you essentially say that the diet is probably the primary thing. Although you can't control for everything, you're controlling for most of the potential things that could be contributing to improved depression symptoms. Now, when you look at Dr. Jacka's research, she's published two trials regarding this dietary intervention that she uses, which we'll get into the details of. And it has a big effect size, very large effect size. The effect size is 1.2. And to kind of put that in perspective, this is like how well the diet works to treat depression. When you look at antidepressants effect size, it's somewhere around 0.3 to 0.6, so much lower than the 1.2 that she got in the two trials that she ran. So she actually tried to make this trial a little bit more robust and randomize the data. And what she did was she randomized people to either the dietary counseling intervention, where they would be taught how to eat properly for this diet, or to basically social support, or what we would call supportive psychotherapy. It's a form of supportive psychotherapy, and that would be a place where they'd be using interventions that are already known to help with depression from a therapeutic standpoint. So be using talk therapy techniques for depression, basically, in that group. So you have a dietary group, you have a group receiving supportive psychotherapy. And what she ended up seeing in this was, after 3 months, the dietary group had a significantly better improvement over the social support group. So there was a significant improvement in depressive symptoms in the dietary group, but not as much in the group that was responsible for social support therapy. So the total number of patients she saw in this trial, in these two trials, was 219 people. So kind of a small number. We've got to be mindful of that. But additional support comes from meta-analysis, where they looked at actually 15 studies and 45,000 total participants. That also confirms these same results, indicating that depressive symptoms improve with changes in diet. Now, the question you might have at this point is, what is this diet? What does it consist of? And how might you use it practically in your daily life? And that's a great question, and it's actually quite simple. What I love about this idea is it's a modified version of the popular Mediterranean diet, but it's not your traditional Mediterranean diet. So you have to make that distinction. And in this diet, there's no specific foods that are prohibited, and there's no calorie counting. So it's like almost not a diet in a way anyway, because you're not, tracking your calories or tracking your macros and micronutrients. you're really it's more of a set of guidelines and principles, which I love, because guidelines and principles can be applied universally, and it really helps the patients to work with the diet more efficiently and not have to have as much restriction and as much tracking of their dietary interventions and what they're consuming throughout the day. So this is general principles that can be applied universally. Now, it's going to consist of the typical foods that you might expect in the diet. So you're going to try to have more healthy options, things like 100% whole grains, beans, nuts, seeds, fatty fish, extra virgin olive oil, and of course, fruits and vegetables. And what they did in these two specific trials was they asked the patients to also reduce their intake of foods known to be noxious to the brain. So the foods that we think of when we're talking about noxious or detrimental to our brain function, we're thinking about processed foods, we're thinking about fried foods, we're thinking about any type of fast foods, any type of sugary beverages, desserts, and refined flours. So they asked the people to reduce those things, but again, not necessarily cut them out 100%. Now the breakdown of the diet goes something like this. For vegetables, you should be looking to get 6 servings per day, and at least one of those servings should be either a tomato or a leafy green vegetable. So tomato-based or leafy green vegetable-based for one. You can use mushrooms. Mushrooms do count, but you don't want to do too many of your vegetables as purely as mushrooms. And you also want to limit your intake of white potatoes. Sweet potatoes are perfectly fine. So again, very simple guidelines and recommendations. Doesn't really require you to do anything too specific except get 1 leafy green or tomato product in per day. For fruits, we're looking to hit 3 servings per day, and of those 3 servings, we're looking for one of those servings to be a berry of some type. Blueberries, raspberries, blackberries, whatever you're into, or some combination of those is a good option. For nuts and seeds and olives, 1 serving per day. For 100% whole grains, we're looking at anywhere between 5 and 8 servings per day. And if you're physically active, you're exercising all the time, you're going to want to shoot for the higher end of that, up to 8 servings per day. For fish, we're looking to have 2 servings per week, and one of those servings should be salmon. Salmon's kind of known to be one of the highest in omega-3 fatty acids, and also one of the healthier fish options for you to eat. So salmon is a good choice. For beans, it's 3 to 4 servings per week. For extra virgin olive oil, you're looking at 3 tablespoons per day. So you're including extra virgin olive oil in your daily consumption of food. Red meat is the interesting one to me. I'm not sure I 100% agree with this, and I'll kind of explain that at the end. But red meat, we're looking at 3 to 4 servings per week, and I'll explain why they chose to keep red meat in this diet when, naturally we think of red meat as being somewhat detrimental to our cardiovascular health and our overall brain function. But we'll talk about that. Poultry, so chicken, turkey, 2 to 3 servings per week. Dairy, you're looking for 3 servings per day, and that could be milk products, cheese products, and or yogurt. Yogurt probably being one of the better choices. For eggs, you're looking at 6 eggs per week. Now, for the foods you're limiting, say fried foods, fast foods, you're looking at a maximum of 3 servings per week. So no more than 3 servings of fast food or fried foods. And this is good because it keeps some of those things that we enjoy eating and that are pleasurable to eat in the diet without becoming too restrictive, right? So you can still have like 3 small meals consisting of fried foods or fast foods throughout the week if you want to. I would say you might want to aim for 1 or 2 instead of 3, but this allows a lot of flexibility in the diet, still keeps things in there that are fun, allows you to go to the restaurant with your friends and family. Alcohol is another big one that we always talk about, so we're going to limit that to 1.5 standard drinks per day. Red wine is preferred if possible. Now, a standard drink that consists of 6.8 ounces of wine, that consists of 2 bottles of beer, or 2 ounces of spirits. So being mindful of how much alcohol you're consuming and what a standard drink consists of is very important. Now this diet, it still takes 2 to 3 weeks to see improvement. So if we think about antidepressant medications, that takes more like 4 to 6 weeks. So people should start to see improvement on the diet a little more rapidly than even the antidepressants, but be mindful it still takes time and consistency to see that improvement. There's no specific risk to using this diet. If anything, it reduces cardiovascular disease risk, it reduces the risk of stroke, and it also reduces the risk of neurocognitive diseases like Alzheimer's disease. We still don't know exactly why this diet works, but there's several possibilities, one of which is that depression may have an inflammatory component to it, and we believe that that's true, and this diet will reduce inflammation. There's also the idea that there's enhanced micronutrient availability and delivery, and those micronutrients consisting of things like magnesium, folate, and B vitamins. So it's high in those micronutrients that are known to impact mental health. And then we also have the same thing we see with exercise is potential for increased brain-derived neurotropic factor. So there's several different mechanisms by which the diet probably works, and each of those plays its role. The last part I just want to discuss briefly, which you guys might have a question about, is the red meat portion and why red meat was included in the diet. Well, in Dr. Jacka's research, what she found was that women who underconsumed or overconsumed red meat had double the risk of anxiety and depression. So kind of interesting finding, but that's why she chose to keep red meat as part of these dietary guidelines. So the only thing she recommends with red meat is that you go with the grass-fed beef instead of the typical beef that you might get off the supermarket shelf, and that has to do with the improved lipid profile of these meats. With all of that said, I'm going to say that to kind of tie this all in, there's evidence to support dietary interventions for the treatment of depression. There's some good observational studies, and we're starting to see some randomized trials looking at dietary interventions for depression. This particular intervention is not really a diet per se, it's more of a set of guidelines or a set of principles that you can apply to your grocery store shopping and your eating habits throughout the day, week, month, and year, right? You can apply these universally, very simple. It doesn't necessarily require you to eliminate foods, it doesn't require you to count calories, and it has some evidence now to support its benefits in depression treatment. So there's a lot of good things here about this diet, and like I said, these dietary principles, and it makes it very, very simple for people so that they can apply it to their lives. With that said, I'm going to cut the video there. If you guys have additional questions or comments about the modified Mediterranean diet for depression, I'd be happy to answer them and discuss them, so drop them below, and please like and subscribe to the channel so that we can continue to make videos like this.